The Avon Orthopeadic Centre is a large unit staffed by specialist fellowship-trained knee surgeons who provide surgical treatments for patients with a variety of conditions, from very simple to the more complex. Before your operation, you'd expect to visit the hospital 2 or 3 weeks to the pre-admission unit. There you would discuss the operation further to make sure that you understood fully what the operation involved and that you consented to proceeding with the operation. We'd also check that you were fit and well enough to undergo the procedure and carry out any tests necessary. When your surgical date arrives, you'd expect to be admitted on the day of surgery and with up-to-date anaesthetic techniques would be expected to mobilise the day following surgery and have a short in-hospital stay. The knee group are a group of fellowship-trained specialist knee surgeons who work very closely together. We work with a number of other specialists such as physiotherapy, radiologists, occupational therapy and the nursing staff. The Avon Orthopeadic Centre is a very large unit. We carry out over 1,000 primary total knee replacements a year and large numbers of ligament surgery and complex revision replacement surgery. We have an international reputation and have regular visits from surgeons from both the UK and abroad, and we run a very strong knee fellowship training programme, again for surgeons both within the UK and abroad.
We're very lucky in North Bristol that we have extremely good purpose-built elective orthopaedic facilities. We have 5 clean air theatres, they're ultra clean air filtered, and we have an extremely low infection rate. So talking of the pre-admission clinic, once you've had your general health screening, if there are any particular reasons to see an anaesthetist, we're very lucky that we have such fantastic quality anaesthetists who are all UK specialist trained anaesthetists. By mobilising early, say within the first 12 hours after joint replacement, certainly within the first 24 hours, it dramatically reduces the rates of clots in legs. We have a dedicated physiotherapy team and they are involved in this early mobilisation, and then they link with the post-operative mobilisation in the excellent facilities in the physiotherapy gym, which is on site. And often the physiotherapists are involved in post-operative care in the clinic as well, with extended role physiotherapists. Any particular issues on mobilisation, we have the facility here on site to use a hydrotherapy pool, and we use a bit like a sticky cling film which goes over the wound, and then we mobilise our patients in the hydrotherapy pool. Particularly beneficial in inflammatory joints and in stiff joints. It's not just medical care, it is also about the quality of our patients' experience. And recently we've won the prestigious Soil Association Award, and this is an award which has been given for our excellent use of locally sourced produce without any additives whatsoever. And this really improves the quality of the experience for you as a patient.
Well, in general, following your short inpatient stay after an operation, usually we'd expect you to see your general practitioner or the practice nurse around about 2 weeks from the operation to check the wounds are healing satisfactorily and that you're making satisfactory progress. If your GP or the nurse has any concerns and wishes to contact one of the hospital teams, there's 24-hour-a-day cover allowing them to make that contact. Obviously, we're very keen to hear your views about how you feel we're performing, such that we can constantly improve our service to you. At the moment we're using a number of validated questionnaires and very soon we'll be using PDAs to gather real-time feedback.